Hello. I'm Dr. Aamir. Welcome to today's health session. Today we will discuss a medical condition known as tonsillitis. Before we start our session, it is requested to kindly subscribe to the channel and share in your community for health awareness.
Dr. Aamir, what are tonsils?
Tonsils are part of the body's immune system and consist of two oval-shaped masses of tissue located at the back of the throat, one on each side. They help defend against infections by trapping and fighting off bacteria and viruses that enter through the mouth and throat.
Dr. Aamir, what is the function of tonsils?
They act as a first line of defense by trapping and filtering out bacteria and viruses that enter the body through the mouth and throat. Tonsils also produce immune cells that aid in fighting infections and play a role in immune memory.
Dr. Aamir, what is tonsillitis?
Tonsillitis is the inflammation of the tonsils, which are located at the back of the throat. It's often caused by viral or bacterial infections and leads to symptoms like sore throat, difficulty swallowing, and swollen tonsils. Treatment includes rest, fluids, and sometimes antibiotics, especially if a bacterial infection is present.
Dr. Aamir, what are the main causes of tonsillitis?
Tonsillitis is primarily caused by viral infections like the common cold or flu viruses. Bacterial infections, particularly Streptococcus bacteria, group of Streptococcus, can also lead to tonsillitis, known as strep throat. Other factors include close contact with infected individuals and compromised immune systems.
Dr. Aamir, why is tonsillitis common in children?
Tonsillitis is more common in children due to their developing immune systems and frequent exposure to viruses and bacteria, often through close contact in schools and daycare settings. Children's tonsils also play a crucial role in the immune response, making them more susceptible to infections. As children grow, their immune systems generally become better equipped to fight off these infections.
Dr. Aamir, what are the signs and symptoms of tonsillitis?
The signs and symptoms of tonsillitis include sore throat, swollen tonsils, difficulty swallowing, fever, headache, and sometimes white patches on the tonsils. Treatment involves rest, fluids, pain relievers, and warm salt water gargles. Bacterial tonsillitis may require antibiotics. In severe cases or recurrent infections, surgical removal of the tonsils, tonsillectomy, might be considered.
Dr. Aamir, how to differentiate bacterial and viral tonsillitis?
Distinguishing bacterial from viral tonsillitis usually requires a medical evaluation. Bacterial tonsillitis, often caused by Streptococcus bacteria, may show specific signs like fever, swollen and red tonsils with white patches, and swollen lymph nodes. Viral tonsillitis might exhibit similar symptoms but could include a runny nose and cough. A throat swab can confirm the cause.
Dr. Aamir, what is the treatment for tonsillitis?
Treatment for tonsillitis depends on the underlying cause. Viral tonsillitis often resolves on its own with rest, fluids, and symptom management, pain relievers, throat lozenges. Bacterial tonsillitis may require antibiotics. Recurrent or severe cases might warrant a tonsillectomy, surgical removal of the tonsils. Consultation with a healthcare professional is crucial for proper diagnosis and treatment.
Dr. Aamir, what is tonsillectomy?
Tonsillectomy is a surgical procedure to remove the tonsils, usually performed when recurrent or severe tonsillitis affects a person's quality of life. It can also address breathing and sleep issues like sleep apnea. The surgery involves removing the tonsils through the mouth under general anesthesia and is often done in an outpatient setting.
Dr. Aamir, what are the side effects of tonsillectomy?
After a tonsillectomy, individuals may experience temporary effects such as throat pain, difficulty swallowing, ear pain, and changes in taste. Some might have a mild fever, bad breath, or fatigue. These effects usually improve within a week or two. Adequate rest, hydration, and following postoperative instructions help with recovery.
Dr. Aamir, what is the recovery time after tonsillectomy?
Recovery time after a tonsillectomy varies, but it often takes around 1 to 2 weeks for most individuals to feel significantly better. During this period, throat pain, difficulty swallowing, and other discomforts gradually subside. It's important to follow postoperative care instructions provided by healthcare professionals for a smooth recovery.
Dr. Aamir, what is the prevention of tonsillitis?
Preventing tonsillitis involves minimizing exposure to infected individuals, practicing good hygiene, regular hand washing, avoiding sharing utensils, maintaining a healthy immune system through a balanced diet, regular exercise, and sufficient sleep. Strengthening overall health can reduce the risk of infections that might lead to tonsillitis.
Dr. Aamir, what is the home remedy for tonsillitis?
Home remedies for tonsillitis include drinking warm fluids, like herbal teas or broth, to soothe the throat. Gargling with warm salt water can help alleviate discomfort. Humidifying the air and resting can aid in recovery. However, consult a healthcare professional for persistent or severe symptoms, as bacterial tonsillitis might require antibiotics.
Thank you, Dr. Aamir. It was great knowledge to share with everyone. I wish to see you about another health topic.
Goodbye, and remember, through discomfort, healing emerges. Let patience and care guide your journey to wellness.